just going on to Google and writing hearing loss, you'll get a lot of information, right? So it's always good to have a starting point, right? If you know that NDCS, for example, is an organization, you go to their website, and if they're signposting, then you go to that. So that gives you a good head start.
I don't know that we could have done it without our teacher of the deaf. She's provided loads of resources for us because I mentioned that I wanted to provide more BSL opportunities for Ella. And I know we have the internet, but you know, you Google BSL and there's so many different things to use. So she's been really good at finding child-friendly, family-friendly resources.
The teacher of the deaf put us onto Essex-based groups on social media. Certainly where we're based, there are a lot of social media groups and social groups that meet up. And any question I want to ask is just on my phone by local mums and dads and caregivers that are just immediately available to help me.
The audiologist actively referred us to NDCS 2 weeks later. So that's when the journey really started. And between us getting referred to the audiologist, the 2-week period, I did a lot of research on NDCS's website, looking at different things, what could be expected. I think there was a guide, parents new to hearing loss. So I went through that guide, and it had a set of questions that you should ask, or you should be prepared to ask the audiologist during your first meeting with them.
Our audiologist though is amazing. She is fantastic and held our hand and continues to hold our hand weekly. She put us onto the NDCS, so I was able to access factual resources rather than just going off on a Google tangent.
When you get the initial diagnosis, I think it is really overwhelming and it's quite scary. I wish that I'd asked more questions early on because I just didn't really understand her diagnosis, and I wish I'd pushed to have the support early on for that diagnosis.
So basically the moral of our journey is equip yourself with as much information as possible. We know our kids best. So the audiologist, teacher of the deaf, our AV therapist, so they gave us advice, and we figured out in the end what worked for Zoya.